Hello, my friends. My name is Dr. Said Kazmi. You're watching my YouTube channel, and today we are going to talk about the situation in which you get a child who has got fast breathing, which we call as tachypnea, and probably has got some difficulty in breathing as well. But when you auscultate the chest is clear to auscultation, and then you're scratching your head that what could be the causes of this type of presentation. So let's dive into this thing. So the first important thing that you should consider when you get a child who has got fast breathing rate with difficulty in breathing, but the chest is clear to auscultation, is what we call as a viral lower respiratory tract infection. Now, what happens? You would argue that most of the viral lower respiratory tract infections or viral wheezes have got viral wheeze. When you auscultate, there is wheeze. But sometimes what happens is that the airways are so much filled up with mucus that the air cannot freely pass over that mucus. Remember, in order for the chest to produce these sounds known as wheeze or rhonchi, there should be turbulent airflow. So turbulent means that the air actually passes like in waves over these secretions and produces that sound what you call as wheeze or rhonchi. So there should be some space for the air to produce that turbulence. But let's say if the airways are so much filled up with mucus that the air is not able to produce those sort of like whirls, then it would not be able to produce wheeze or rhonchi, and what you would hear would be a silent chest. So remember, viral lower respiratory tract infection in some stages can give you a clear chest to auscultation. In that particular case, if the history is pointing towards a viral LRTI, lower respiratory tract infection or viral wheeze, give them a trial of nap. Many times what happens, the chest is clear to auscultation, but as soon as you give the nap, the child clinically improves. But when then after that you listen to the chest, you listen that the chest is full of all these noises known as rhonchi and wheeze. So viral wheeze or viral lower respiratory tract infection, those situations in which the airways are full of mucus would not give you any sound when you auscultate the chest. So that you should keep in mind. Another important thing is that let's say if you think that the child hasn't got a viral wheeze or a viral lower respiratory tract infection and the child is presenting with tachypnea or difficulty in breathing, you should also look at the heart rate, because if the child has got tachypnea and tachycardia, then it becomes very important to look for the liver margins of the liver as to see if there is any hepatomegaly or not, because the triad of tachypnea, tachycardia, and tender hepatomegaly points towards heart failure because of any reason. So try to rule out that as well. And sometimes you might be, rarely you might come across a condition in which a child has got tachypnea. He looks unwell, everything else is fine. And the reason for that tachypnea is basically an underlying acidosis, metabolic acidosis. And that can happen in the first presentation of a diabetic ketoacidosis. So that relatively is rare. But remember, sometimes if you don't find any reason, just do the blood glucose and just look at the ketone levels. You won't be surprised to see that the ketones are elevated and the blood glucose is also elevated. So these things you should keep it in mind. Now, some of the systemic causes, other systemic causes of tachypnea with difficulty in breathing where the chest is clear could be hypermetabolic states, like for example in high-grade fever or certain types of endocrine conditions in which there is hypermetabolic state like hyperthyroidism can also give you tachypnea. Similarly, if a child has got severe anemia where there is a severe drop in hemoglobin, there will be a compensatory tachypnea, and these children, you would see that they have got a fast breathing rate. Then going down to the cardiovascular causes, I told you that if there is a triad of tachypnea, tachycardia, and tender hepatomegaly, you should be considering heart failure. But sometimes, even if the child hasn't got any heart failure, they might be having tachypnea and tachycardia because of an underlying congenital heart problem. Like, for example, all those structural heart problems which are giving left to right or right to left shunt. Or sometimes, if because of any underlying structural heart problem, there is an increase in the pressures across the pulmonary circulation, which we call as pulmonary hypertension, that might give rise to tachypnea, difficulty in breathing, but the chest would be clear to auscultation. Then, some of the extra pulmonary causes that can give you tachypnea is like a high grade systemic inflammation. For example, what happens in sepsis, or sometimes some conditions like if a child has got pain or has got fear then in that case also the child would be having hyperventilation leading to fast breathing rate. In adolescents, sometimes those who have got generalized anxiety disorder or those who have got panic attacks, you will see that they are hyperventilating and you would find tachypnea, though the reason for that is psychogenic. Rarely you might come across neurological causes like increased intracranial pressure leading to tachypnea because there is a brain tumor or some other pathology inside the skull that is causing an increased intracranial pressure. And then there are a few rare causes of tachypnea where the chest will be clear to auscultation is what we call as the early stages of interstitial lung disease. Now, interstitial lung disease is an umbrella term which encompasses so many restrictive lung problems. But in the early stages, what you will see is that there's tachypnea, but the chest is clear to auscultation. Last but not the least, you should be thinking of overdoses. Certain types of toxins or medications can lead to tachypnea, especially in adolescents if they are looking unwell and the history is a bit dodgy. You should be considering salicylate or aspirin poisoning because aspirin poisoning leads to tachypnea in the early stages, and that leads to metabolic alkalosis. Then it is followed by, it leads to respiratory alkalosis in the early stages. Then it is followed by metabolic acidosis. So, aspirin or salicylate poisoning, remember that is also an important cause of tachypnea where the chest is clear to auscultation. So, these are a few causes of tachypnea in which the chest is clear to auscultation. If you cannot remember all of these things, you should remember the mnemonic facts, which stands for some of like, for example, high-grade fever, anemia, cardiovascular reasons, toxins and acidosis because of decay, sepsis, stress, pain, etc. So remember the mnemonic facts if you cannot remember all these causes, but by and large, remember the most common causes are viral lower respiratory tract infection. And after that, as I told you, there are so many causes that can cause tachypnea without any noises in the chest. So whenever you come across this condition, remember these things in your mind. Have a very good day. Take care and bye-bye.